When it comes to antiviral medications, Valtrex is a widely prescribed and trusted drug for treating herpes infections. However, it's essential to understand that even though Valtrex is generally well tolerated, there are potential side effects that may arise. In this video, we delve into uncovering the lesser-known side effects of Valtrex, shedding light on crucial information that patients and healthcare providers should be aware of. From headaches and dizziness to nausea and abdominal pain, Valtrex's side effects can vary in severity and impact individuals differently. Our aim is to provide a comprehensive understanding of these side effects, without sensationalizing or spreading inaccurate information. By exploring available research and scientific studies, we aim to equip readers with the knowledge they need to make informed decisions about their health and treatment options. Whether you are considering Valtrex as a treatment option, or you are currently taking it and want to be well informed, this video will serve as a valuable resource. Stay tuned as we uncover the truth about the often overlooked side effects of Valtrex, empowering you to prioritize your well-being. Common side effects of Valtrex. Valtrex, also known as Valacyclovir, is an antiviral medication that is commonly used to treat herpes infections. Like any medication, Valtrex can cause side effects, although not everyone will experience them. The most common side effects of Valtrex include headaches, nausea, vomiting, diarrhea, and abdominal pain. These side effects are usually mild to moderate in severity and go away on their own within a few days. Other common side effects of Valtrex include dizziness, fatigue, and fever. These side effects can occur during the first few days of treatment or after prolonged use of the medication. In some cases, Valtrex can cause skin rash or itching, although this is rare. It's important to note that although these side effects are common, they are not usually serious and do not require medical attention. If you experience any of these side effects while taking Valtrex, it's best to speak to your healthcare provider. In most cases, they will recommend that you continue taking the medication as prescribed, as the benefits of Valtrex usually outweigh the risks. Lesser-known side effects of Valtrex. While the common side effects of Valtrex are generally well known, there are several lesser-known side effects that may occur. These side effects can occur in a small percentage of people and can have a significant impact on their health and well-being. One of the lesser-known side effects of Valtrex is hair loss. Although this side effect is rare, some people who take Valtrex may experience hair thinning or hair loss. This side effect is usually temporary and resolves within a few months after stopping the medication. Another lesser-known side effect of Valtrex is photosensitivity. This means that some people who take Valtrex may be more sensitive to sunlight and may experience a rash or blistering after exposure to the sun. To avoid this side effect, it's essential to wear protective clothing and use sunscreen while taking Valtrex. Valtrex can also cause changes in vision, including blurred vision or difficulty focusing. While this side effect is rare, it's important to speak to your healthcare provider if you experience any changes in your vision while taking Valtrex. Impact on the immune system. Valtrex works by blocking the replication of the herpes virus, which helps to reduce the severity and frequency of outbreaks. However, some studies suggest that Valtrex may also have an impact on the immune system. Research has shown that long-term use of Valtrex can lead to a decrease in the number of white blood cells, which are essential for fighting infections. This means that people who take Valtrex for an extended period may be more susceptible to infections and illnesses. While this side effect is rare, it's important to speak to your healthcare provider if you have a weakened immune system or are taking other medications that can suppress the immune system. Your healthcare provider may recommend alternative treatment options or adjust the dosage of Valtrex to minimize the risk of side effects. Valtrex and kidney function. Valtrex is primarily eliminated from the body by the kidneys, which means that people with kidney problems may be more susceptible to side effects. Research has shown that Valtrex can cause kidney damage in some people, especially those with pre-existing kidney disease. Symptoms of kidney damage may include changes in urine output, swelling, and fatigue. If you experience any of these symptoms while taking Valtrex, it's important to speak to your healthcare provider immediately. They may recommend that you stop taking the medication or adjust the dosage to minimize the risk of kidney damage. Potential cardiovascular risks. Recent studies have suggested that Valtrex may increase the risk of cardiovascular disease, including heart attack and stroke. While the exact mechanism behind this side effect is not yet fully understood, it's important to be aware of the potential risks. If you have a history of cardiovascular disease or are at high risk for developing these conditions, it's essential to speak to your healthcare provider before taking Valtrex. They may recommend alternative treatment options or adjust the dosage to minimize the risk of side effects. Psychological side effects of Valtrex. While Valtrex is primarily used to treat physical symptoms of herpes infections, it can also have an impact on mental health. Research has shown that Valtrex can cause mood changes, including depression and anxiety. If you experience any changes in mood or mental health while taking Valtrex, it's important to speak to your healthcare provider. They may recommend that you stop taking the medication or adjust the dosage to minimize the risk of psychological side effects. Interactions with other medications. Valtrex can interact with other medications, including over-the-counter drugs and supplements. It's essential to speak to your healthcare provider before taking Valtrex if you are taking other medications. Some medications can increase the risk of side effects or reduce the effectiveness of Valtrex, while others can interact with Valtrex and cause dangerous side effects. Your healthcare provider will be able to advise you on the best course of action and recommend alternative treatment options if necessary. Managing and minimizing side effects. If you experience any side effects while taking Valtrex, there are several things you can do to manage and minimize them. Firstly, it's essential to speak to your healthcare provider if you experience any side effects. They may recommend that you adjust the dosage or switch to an alternative treatment option. You can also take steps to manage the common side effects of Valtrex, such as drinking plenty of fluids to prevent dehydration and taking painkillers to relieve headaches or abdominal pain. It's also important to get plenty of rest and avoid strenuous activity while taking Valtrex. Conclusion: weighing the benefits and risks of Valtrex. Valtrex is a widely prescribed and trusted medication for treating herpes infections. However, like any medication, it can cause side effects that may impact your health and well-being. By exploring the lesser-known side effects of Valtrex, we hope to empower readers to make informed decisions about their health and treatment options. If you are considering Valtrex as a treatment option, it's essential to speak to your healthcare provider about the potential risks and benefits. They will be able to advise you on the best course of action and recommend alternative treatment options if necessary. While Valtrex can cause side effects, it's important to remember that these are usually mild to moderate in severity and go away on their own within a few days. By managing and minimizing these side effects, you can continue to prioritize your well-being while taking Valtrex. Thanks for watching.